Hi, my name is Dr. Satish Magge. I'm one of the cardiologists working in Trinity Health Center for the last 24 years. I practice cardiology, interventional cardiology, nuclear cardiology, and vascular medicine. I'm board certified in cardiology medicine, interventional cardiology, and nuclear cardiology. I'm the chairman of Department of Cardiology and also the chief of Chest Pain Center here at Trinity Medical Center. February is designated as the Heart Month. This was started by Lyndon Johnson in 1963 and 1964 to raise the awareness to the people, and is dedicated to that because more than half of the population were dying from heart disease. Heart disease basically is broadly divided into coronary artery disease, hypertensive heart disease, congestive heart failure, valvular heart disease, and arrhythmias. So basically when we talk about heart attack, basically I'm concentrating on coronary artery disease. Heart attack is basically, in the simple way to tell to the common people, is human heart is supplied by three major arteries to the heart. When the blood flow to the heart is compromised by any kind of a blockage, that decreases the circulation to that portion of the heart, and that portion of the heart suffers damage. That is called heart attack. It is also called myocardial infarction, which a lot of people know as. Basically, in the broad spectrum, to help in risk stratifying the patients, the heart attack is divided into a non-ST elevation myocardial infarction and an ST elevation myocardial infarction. This is basically framed from the EKG findings that we see, the biomarkers, and the symptoms. So whenever anybody having what we call a heart attack, the symptoms vary from person to person. There are significant risk factors for any kind of heart disease. Some of them are called modifiable risk factors, some of them are non-modifiable risk factors. Modifiable risk factors are hypertension, smoking, diabetes, cholesterol, and obesity. Non-modifiable risk factors basically are gender, race, age, and you can do nothing about it. But you can definitely modify the risks that were involved with promoting and progressing heart attack. The symptoms of these heart attack varies from person to person, age, race, and sex. So anybody, if you think you are having a heart attack, you should immediately call 911 or notify your family members, and you need to drive, if it's possible, try your best that somebody drive you to the hospital. So the actual real way of presentation could be chest discomfort, radiation down the left arm, shortness of breath, sweating, and just plain jaw pain. Particularly women present with atypical symptoms rather than the classic crushing chest pain. So we always encourage women, if they have atypical symptoms of shortness of breath, mild jaw pain, interscapular pain, shoulder pain, to take it seriously, particularly if we have significant risk factors that I said for coronary artery disease, like diabetes, hypertension, family history, high cholesterol, and obesity. So when we talk about the risk factors, life's simple 7. Get active, cholesterol control, controlling your diet, controlling your blood pressure, weight control, blood sugar control, and smoking cessation. These are extremely important modifiable things that you can do. If you practice at least 50% of all these simple 7 that I talked about, you can reduce the progression and start of the coronary artery disease by at least by 50%. It is that important. So like I said, anybody having the chest pain, immediately notify the 911 or go to the hospital, nearing hospital. So on the way to the hospital, if they determine by the EKG that you are having a ST elevation myocardial infarction, that means that human heart has major coronary arteries. If you have a complete occlusion of the artery, that causes the ST elevation MI, or called STEMI. Before we used to call the transmural myocardial infarction because it involves all the three layers of the heart, and that causes significant damage to the heart in that area. Importance of that is when you know that there is an ST elevation myocardial infarction happening, means a major heart attack occurring, they will notify the emergency room in Trinity, and the cath lab will be ready 24/7. All the time the interventional board certified cardiologists are ready, and immediately the cath lab will be also notified. There are medications that we use before you go there, but one thing that I want to tell you, if you think you're having a heart attack, if you already have history of heart disease, use the nitroglycerin that you use, take an aspirin as soon as possible if there are no contraindications. The patient will be immediately taken to the cardiac catheterization lab, and if you have 100% blockage, there is a 90 to 95% chance that we are able to open it and put a stent and establish the blood flow and stop the dying heart. Time is muscle. Sooner we take the patient to the cath lab, it is much more better preventing the damage that occurs to the heart. If it is not the ST elevation myocardial infarction, patient will be triaged in the emergency room, and they will do the EKG, and they will do what are called biomarkers, which will tell us the patient is having partial occlusion causing non-ST elevation myocardial infarction. If you have a partial closure causing a heart attack, if the risk stratification shows us that they are a higher risk, that we risk stratify by using heart score, then the patient will be taken to the cardiac catheterization lab. If they are intermediate risk, then we risk stratify them, treat them with medications like blood thinners, cholesterol agents, anti-anginal medications. If they are low risk, patient will be admitted to the hospital with serial enzymes to making sure that he is not going to have a heart attack, and then we will risk stratify them doing pharmacological stress test or the exercise stress test, and also will get an echocardiogram. Trinity Medical Center is highly equipped with the state-of-the-art cardiac catheterization lab, and also with the state-of-the-art board-certified interventional cardiologists who've been experienced for 25 to 30 years or even more, who knows what they're doing. And patient will be taken to the cardiac catheterization lab, and like I said, 90 to 95% success rate opening the arteries and stuff like that. Of course, there are complications involved. Sooner we take the patient to the cardiac catheterization lab and take care of the heart attack and prevent the progression of the heart disease is the key. So the importance thing that we talk to you about is the most important. So there are certain things, like I said, non-modifiable risk factors you can do anything about. Quitting smoking 1 cigarette a day decreases the risk of your heart disease by 46%. It is very, very simple thing that any person can do to prevent the progression of the heart disease or starting the heart disease. You will be helping yourself a lot. Exercising daily, at least about 40 minutes 3 times a week, or rigorous exercise about 30 minutes every day, is lifestyle modification, is the most important preventive aspect. Eating right, particularly fruits and vegetables, avoiding red meat is an extremely important thing. Diabetes management is extremely important, and knowing what to eat and following up with the proper specialist and the primary care physician, and blood sugar control and cholesterol control is extremely important. By modifying your lifestyle, even before the heart attack and after the heart attack, is extremely important and prevents future events to you. Talking about the causes of the heart attack, going less into technical terms, the narrowing of the arteries is formed by the accumulation of what we call plaque. Plaque is basically formed by accumulation of cholesterol and platelets, which slowly start from the middle life or even younger life, but progresses as we get older. There is a myth that women never get heart attacks, younger women does not get a heart attack. These myths are wrong. Unfortunately, women present to the hospital at a later age compared to men. So that is extremely important with atypical presentation in women, and particularly if they are diabetics, very important to tell your doctor or come to the hospital, be aware of the atypical symptoms that I talked about. See, progression happens as we get older, and if you have risk factors like smoking, diabetes, hypertension, I keep on pressing, will help promoting this plaque, and this plaque, whenever it ruptures, gives you the heart attack. When it ruptures, the blood clot spills into the blood, and then that's where the damage occurs. All these risk factors trigger the rupture of these plaques. Plaques could be stabilized by modification of the life, by quitting smoking, eating right, controlling the blood pressure, and that will stay and keep it calm, your heart disease. By doing it, stable plaques can be lost without any problem for a long time, as long as you take your medications, take care of the lifestyles like that we've talked about. Complications do occur, and if you don't go to the doctors per se, the heart attacks can damage the heart, cause dangerous arrhythmias, can cause heart failure. The most important thing that we do immediately taking to the cath lab, opening the blockage, is to save that muscle. If the muscle is damaged, we are a little late. So if we go into that 90-minute window that we talk about, door to balloon time, as when the patient enters to the emergency room and to the cath lab and the laser is placed, a lot of studies have shown significant improvement in preventing damage to the heart. So sooner you notify, sooner you think that you are having a heart attack, sooner you go to the emergency room, better for you. Healthy hearts love longer.